Hi everyone, on this episode of Simcoe County Shop Local, I am with, Sue, you don't need any introduction for the people here in Midland, Penetang area, but tell everyone watching who you are and where we are.
We are currently in the clinic at Abilities Rehabilitation and Counselling Services. I am Sue Cook and I'm an occupational therapist. I started this business in 2000.
Okay, so let's back up a little bit. What is Abilities?
Abilities is a rehabilitation clinic. We are a multidisciplinary clinic, so we have physiotherapy, occupational therapy, social work services, counseling, children's therapy. The list goes on. We cover many areas, and we also cover many different types of issues that people may have. So we will see clients from pediatric, from young children, through to geriatric in age, and we cover almost any spectrum of disability.
So off the top of my head, say someone is watching and they get hurt at work. Can they come here?
Yes, they can. And we will work with WSIB. So they will come here. There may need to be a job site assessment completed, or there may need to be a functional capacity assessment completed, which we can do. We will also develop return to work plans if employers require them. We will do physical demands analysis of the job if employers require a demands analysis because that has never been completed, which sometimes that does happen. So we will complete some of those as well. And then try to set up a return to work program so people can get back to doing what they want to do.
Another scenario that you might be able to assist with is if my grandmother needs help with how to actually live by herself now that she needs a walker, things like that. You can help with that too.
Yes, that one question encompasses a lot of issues. So the first thing would be aging in place is very important for our community. See, everybody wants to stay in their home. So we would like people to help people do that. We may come out and look at the home, suggest modifications for safety so that you are able to age in place. If you require equipment such as a walker, a wheelchair, a scooter, we have therapists that are certified with the Assistive Devices program. And they can assist with completion of those activities and paperwork, so that some funding can be provided. So we can look at that. We can look at the home. We can look at what's required. If the disability requires some rehabilitation because of a physical issue, such as a stroke, we also complete neurological rehabilitation as well.
You pretty much do everything here.
Yes, we do encompass quite a large area, and I believe that's because as the owner of the business, I'm an occupational therapist, and I would argue that occupational therapy is only the true holistic profession out of all of the professions out there. We can work with any age group from premature babies to geriatric and palliative care. We are trained in that, and we are also trained in any disease spectrum. So it may be psychological, psychiatric, or it might be physical or neurological.
What's the one thing you want everyone to know watching about the Ability Center?
That we're here.
Yeah.
A lot of people will come into the center because they have found us on our website, or they have been referred by a physician or somebody that has come here before. We have been here for almost 20 years and constantly growing, continuing.
Speaking of where you are, where exactly are you situated?
Well, we're on the corner of First and Dominion Streets in Midland. It is an accessible building, and parking is in the rear, so you don't have to pay for parking.
We're going to speak to a few more people that help at the center here. But in the meantime, how can everyone get a hold of you?
Well, the best way to get a hold of us is to just give us a call, which our phone number is 705-527-5757. You can also go onto our website. If you just Google abilitiesrehab.ca, you'll find us. So there's many different ways, but those are the two big ones that we find people use most of the time.
Thanks, Sue.
Thank you.
Okay, so we're back, and we are with Lisa Martinez. Lisa, what do you do here?
I am a physiotherapist here.
And before I dive in with Lisa, She's got a prop here. She knew I was going to ask her what it was. What is this that we have here?
So this prop is actually a very enlarged model of the vestibular system, which is inside your inner ear. We have two of them actually, one in the left, one in the right. And one of my specialties in treatment is treating vestibular issues. So I use this often to explain to clients what is going on.
And what exactly is vestibular?
Vestibular. This vestibular system is a system that helps us with balance. So it's one of the components of balance. So between the vestibular system, your visual system, your eyes, as well as the rest of your body, it helps you maintain being in balance. If there are any issues with this particular system, it gives inaccurate information to the brain. So your brain interprets that as being dizzy or feeling nauseated or having vertigo, feeling off balance. So many people that I see come in with dizziness, and then we do treatment to fix that.
What's one thing you want everyone to know about your job here at Abilities?
Well, I love being a physiotherapist. I love doing vestibular rehab and would love to help as many people as possible who are having dizziness so that they're not dizzy.
If someone can't come to see you here, are you able to go to their location?
Yes, I do also see people in their homes. So I treat in the clinic as well as in the community in people's houses.
And when you say you treat here in the clinic, what are you able to do here with regards to vestibular?
So the vestibular exercises and treatment is not typically what you would think of when you're thinking about physiotherapy. So we don't give balance exercises that are specific to retraining around the ankle if you've had a fracture, etc. So I can do that anywhere. I can do it in a person's home. We can do it on their bed, on the couch. We have an office here, a specialized treatment table, so we don't need a lot of space for it.
And even if someone has a workplace injury and they have a problem with this, they can still come here as well too.
That's right, yeah.
Perfect. Where are you guys located?
In Midland. 248 First Street. Midland.
And again, you will take on from children all the way to seniors.
That's right, yeah. Any age group.
Perfect. And again, you are?
Lisa Martinez, physiotherapist.
Lisa, thanks for coming in and chatting with me.
Thank you. It was a pleasure.
Okay, so we are with now
Lori St. Louis.
Lori, exactly what do you do here?
Well, I'm the director of social work, so I oversee a team of social workers, rehab consultants who support clients in their home and in the community across this area.
So give us an example. What happens if someone needs you?
Well, they would call the head office and they would be patched through to me, and I would find the right clinician or therapist to work with them depending on what their needs might be.
And what's one thing you want everyone to know about meeting with you and you assessing the entire situation?
Well, it's sometimes frequently difficult for people to go into an office and disclose new information about something that they may have been struggling with. But we have a team of skillful clinicians that can work with a variety of people, a variety of age groups, and a variety of difficulties or disorders that they might be facing in order to help them get back to where they want to be and achieve their goals.
For example, if a child says to their parents, I think I need to talk to someone, they can call you.
Absolutely. And what's really exciting about Abilities is that we have clinicians who do play as part of their therapeutic interventions. So that's a really nice, unique thing, because children might not be wanting to say their words and may not really have that expressive knowledge around their feelings. And we also have clinicians who specialize in individuals who have experienced multi-trauma and loss and acquired brain injuries and things of that sort. So we're well versed in what those individuals might be facing, recognizing that every experience is unique for the individual.
You touched a little bit about a play. There is a special room here for children as well that they can use.
Absolutely. And we do have the offices here, the therapy offices here. We have counseling rooms here. We also have space in Wasaga Beach in order to provide therapy and counseling. We have a counseling room in that area as well. And many of our clinicians support clients in their home. So frequently, as a result of injuries or sometimes it's an anxiety disorder or something of that sort, the individual might not be able to get out of their home. And we are able to provide support, counseling in their home, life skills training, so that the individual can get back to their goals and where they want to be. At the end of the day, individuals want to return to productive and meaningful activities, want to have that sense of well-being in their life. And many of our clinicians have some highly skilled specialties that are able to support the clients.
I really appreciate you speaking with us and having some time to let everyone know about this center.
Well, thank you so much, and thank you for coming here today.
You're welcome. Thank you.